Bismillahirrahmanirrahim. Dear audience, this is Dr. Huma Umbreen from Department of Nutritional Sciences, GC University, Islamabad. First of all, I am thankful to the organizers for providing me a chance to present in such a big event, that is International Conference on Applied Zoology. And without any delay, I will be starting with my topic, that is the bovine colostrum, an ameliorant for muscle growth and fitness. These are different outlines of my study. And if we talk about the bovine colostrum, you will be well aware of it. Then this is the first milk secreted by initial days of the cows when it gives birth. And it is yellowish, reddish, and thick liquid. And when we talk about the most important component of bovine colostrum is its composition, because it contains lesser amount of lactose that is different from milk, and it is higher in fat, different type of growth factors, proteins, cytokines, vitamins, minerals, and different types of peptides and non-protein nitrogens. And this, you can see this is a pictorial representation of the bovine colostrum composition, that it contains different types of growth factors, immune factors, and the cytokines, different types of enzymes. And these all factors are important with respect to the health of the human body also. As you can see over here, that with respect to the respiratory tract, with respect to immune system, brain activity, and heart, this is important in every cell, in every system. The topic that we had chosen to fit this bovine colostrum was the sports nutrition. Why we had chosen this sports nutrition? Because if you look into the nutrition supplementations, there is a trend not only in the sports person but also in the active male, that they want to increase the muscle mass. They want such type of supplements which are higher in the protein, which are higher in such of the components which decrease muscle inflammation, which decrease muscle damage, because they will ultimately increase the muscle mass. So all of such qualities are present in this bovine colostrum. Therefore, we had chosen this bovine colostrum with respect to the athletic performance and muscle growth. These are different types of studies which have been done for bovine colostrum supplementation in sports. The initial study that has been observed, it was in 1997, and then it continued, and still it is in progress. The objective of the present study were to check the effect of bovine colostrum supplementation during training on the blood biochemical profile, and to examine its effect on muscle mass, growth factors, and fitness of the person. These are different methods that had been used. First of all, the study design was randomized control design. All the subjects had been part of this study randomly, and along with it, they were voluntarily a part of this study. And the sampling technique was convenient, and sample size was 40. These are different processes which have been performed for this bovine colostrum. These were procured from different dairy farms of Faisalabad and Gujranwala, and it was cooked until it is dehydrated. Then it was sieved and was packed into different types of packings, so that according to the different treatments that I will discuss later. Here are the different treatments which we had used, and this was 20 gram, 40 grams, and 60 gram of bovine colostrum, and the first patients have to take it with 1 glass of water. Therefore, the control group was only given 1 glass of water, and this was given, they were instructed to take this bovine colostrum 30 minutes before their activity. The study continued for 8 weeks, and the results were taken before the study and after the study. This is the inclusion criteria. Most of the people who join gym or who are doing the athletic performance, these are between the age of 18 to 35 years. Therefore, this age slot was taken, and it involved highly physically active males. And we had to looked into it, that they should be willing to improve fitness. They wanted to improve the fitness and blood biochemical profile, and they are cooperative and determined to improve the muscle mass. And we had also tried one thing, that their baseline values are almost similar or near to each other, so that there is more precision and accuracy in the results. And the exclusion criteria, definitely, if we had taken 18 to 35 years of age, so age less than 18 and greater than 35 were excluded, and all the persons who had been using any type of supplements, medications, milk or soy, having allergies, and suffering from any type of disease were not participating in the study. They were excluded from the study. And some people who were athletes, but they were not taking any type of exercise for last 3 months, therefore these were also excluded from the study. And the outcomes were measured. Not only the blood biochemical profile was taken, but also the physical measurements were taken, and these were based upon the BMI and 1 mile run test. This is for the fitness test, and we wanted to see how much do they gain the fitness to run 1 mile or 1.6 kilometer in a minimum possible time. And this was taken before and after the study. In the blood biochemical profiling, insulin like growth factor 1, creatine kinase, and serum creatinine was assessed. Statistical analysis was done so as to know the significant difference, and so that we may know what is the difference between the values between the control and the treatment groups. This is the physical characteristics, as you can see over here, that there was increase in the weight to some extent as compared to the control group. As I have already told, that these were almost at the same age, height, and weight levels and BMI levels. But overall, it has been looked into that weight of the participants increased and BMI also increased. And one thing that I want to mention over here, that this increase was not in the fat mass, rather it was in the lean mass. And the results which I will be showing after this, that is the in growth factors, you can see that muscle improvement may be related to those growth factors which have been provided by the bovine colostrum. Yes, you can see over here that in the first, you can see this is insulin like growth factor 1, and it has been increased dose dependently. T1 which was given 20 grams, and T2 which was given 40 grams, and then T3 which was given 60 grams. You can see over here that there was increased dose dependently. Similar was the case with the serum creatinine, that it also increased dose dependently. And one thing that I want to mention over here, that serum creatinine level is usually higher in sportsmen. Creatine kinase, which is related to the muscle injury, you can see over here that its value decreased with the increase in bovine colostrum concentration, bovine colostrum value that was given to the volunteers. And it shows that there was reduction in muscle inflammation and muscle damage. Therefore, you can see over here not only that it is providing the growth factor to improve the muscle mass, but it is also preventing such factors which are damaging to the muscles. So it is preventing the muscle injury as well as muscle damage. As the days are increasing, in both cases, you can see over here that there is less time being taken to conduct this 1 mile test. Therefore, on the basis of this was all about my study, and on the basis of this study, you can see over here that bovine colostrum supplementation not only increased the weight and BMI that was resulting due to the muscle mass increase, but also it significantly increased the IGF and serum creatinine, whereas it caused the reduction of creatine kinase, and thus prevented the muscles from damage along with the increasing the growth. And it also improved the fitness and exercise performance, as is shown by 1 mile test. On the basis of this, if we look into this study, then we can see this is the cheaper and easily available source of protein and different types of growth factors and immune factors. And if it is used as a supplement, not only for the sports person but also for the children, then it will not only increase the immunological properties of the people, but also it will help to gain growth, and will help in development of the persons, not only the sports but also the children. These are different references that I have used, and thank you so much for your attention.